Foundation, and he wants inclusion for people with intellectual disability.
All right, good morning, everyone. Introducing Mrs. Evotaye. She's an ally. She's a parent of a. She's a parent. She's here with her son, Caleb Evota.
Good morning, everyone. I am Mrs. Evota Owa, like she said. I'm a parent of a child with Down syndrome. His name is Caleb Evota. What I'm advocating for is inclusion in everything for these children with special needs. How? By having teachers, having special educators in all schools, and there should not be these children. These special ones these ones with special needs should not be segregated. They should be included in everything in school, and this can actually be achieved through special educators in various schools. Thank you.
My colleague here is Adiola Adeniji, and what she's advocating for rather is inclusive education for persons with intellectual disability.
Good morning.
Hello, sorry. Please, the Zoom is live. If you can tell your cluster member that are joining online that they can join now. Thank you. Sorry, you can continue.
Good morning, everyone. My partner here is Adiola Adegunbiade, and she's advocating for increasing knowledge among duty bearers for rights of persons with disabilities, psychosocial disabilities in particular.
Okay. Can I introduce myself by myself? Nobody to introduce.
Introduce yourself by yourself.
Okay. My name is Ijoma Fine Country. I am a parent to a child with Down syndrome. I am also an inclusion advocate. I believe that persons with intellectual disability should be totally and fully included in the society in every aspect, whether education, health-wise, social-wise, politically. And that is why what we are doing today here is very key. And the expectation of today's learning is very, very important to us. And of course, the General Right in Action project. Thank you very much.
Thank you very much. Please, let's pass the microphone. And please, let's all remember to document our expectations. As we have said them, let's write them. After the introduction, I'll come to each table to take them. Thank you all.
Good morning, everyone. I'm introducing Abigail Alade, a student of Bingham University. She's advocating for access to education and employment opportunities for persons with intellectual disability.
Good morning, everyone. My name is Abigail Alade, and my partner's name is Ayobami Adefu, a project manager of the English ones. She is advocating for accessibility and accommodation for persons with intellectual disability.
That's table, right? Okay. Coming to your table right away.
Good morning, everybody. My colleague is Kabati Ishaya, and she's advocating for the inclusion of persons with psychosocial disability.
Good morning, everyone. My name is Kabati Shaya. My colleague's name is Samira Young, advocating also for people with psychosocial disabilities.
Good morning, everyone. Since I don't have a colleague, I'll introduce myself. So my name is David Musa. I'm the project manager for YCAF Foundation, and we are advocating for the inclusion of people with psychosocial disabilities. Thank you.
So, Secretariat, please. Please yourself.
Thank you. Good morning. My name is Nansel Samuel. Okay, I work with the Inclusive Friends Association.
Good morning. My name is Peter Chidi, JONAPWD. I work as finance manager. A part of this RIA team. Thank you. I welcome you.
Good morning, everyone. My name is Khadija Tadekoya. I work with Inclusive Friends Association, the finance officer.
Good morning, everyone. My name is Zainab Yahaya. I work with the National Secretariat of Joint National Association of Persons with Disability. Thank you.
Can we meet you, Mr. Shea?
Good morning, everyone. My name is Moses Oluwaseyi. I run errands for the Inclusive Friends Association on a daily basis. Thank you very much. You're welcome all. And my expectation, I look forward to full participation of everyone seated here. Thank you.
Thank you so much.
Okay. Good morning, everyone. My name is Oluwapamilerin Victoria Oluwajuibe. I am the Operations and Programs Officer at Mental Health with DT Foundation. I am the Operations and Programs Officer at Mental Health with DT Foundation. Yeah.
Good morning, everyone. My name is Oba Mercy Joma. I work with Mental Health with DT Foundation. Thank you.
Thank you so much, everybody. I hope that we've all written our expectations down because we are coming for it now. Please, have you all written the expectation on the sticky notes that I drop on your table? See them? No, everybody. So if we have them written already, my colleagues are going around to collect them. I also want to ask if all of us have gone through the agenda for today and tomorrow. I'm sure all of us have seen the activities that we'll be having today and tomorrow. On that note, I would like for us to nominate 2 persons that will be our rapporteur for today and 2 persons for tomorrow. Oh, can we have a volunteer for that? Please. Thank you. I heard that some of us want inclusive education, everything to be inclusive, and that's why we want to carry us all along. So this training is it has to be a participatory training, which will involve everybody. Can we have one person from NNAD, one person from She Rights to be our rapporteur? Sorry, I'll need a volunteer from She Rights and RBM for today section. You volunteer? She Rights for She Rights. So what of RBM? Okay. Sorry, can you tell us your name again? Sorry. We have somebody already. Don't worry. He will do for tomorrow. No, don't worry. Favor. We have Madam Favor and Maxwell. Thank you. They will be our rapporteur for today. Can we also have a timekeeper so that I know that we've spent a lot of time, but let's continue from here. Can we have a timekeeper? Who is going to volunteer? Who will be a volunteer for you? Madam Grace. Madam Grace. Will you be our timekeeper for today? Thank you. I would have said Madam Fine Country because she's not with us since. Thank you. If we have all gone through our agenda, there is no need to review it again. Okay.
Okay, hello. Good morning once again. I'm just here for a brief notice, housekeeping, right? So that we can know where and where to go when some things go off point, right? First, when you hear the security alarm, should in case of emergency, as instructed from, but as directed by the hotel, this is the entry and the emergency exit. So you go and take the exit door out, down, should in case of fire incidents or any sort of emergency within this facility. Then for convenience, if you want to ease yourself, if you go, immediately you go out of the door here, to your left, there's a path to your left that leads to where you can be able to use the restroom. And then our lunch and dinner will be served in here. Sorry. Our breakfast, tea break and lunch will be served just here. So it's going to be a walk-in lunch and a walk-in tea break. Thank you very much.
Okay, I would like to take us quickly through the project overview. I know that most of us are already familiar with it, but for the sake of the new people that we have, Rights in Action Project Introduction is a program that supports organization of persons with disability, which all of us are from, to speak up for their rights using evidence and strong advocacy to be able to achieve our needs, our desired needs. Background: the project is a 2-year project which is funded by government of Finland. It is also coordinated by CBN Global and co-implemented by JONAPWD, Joint National Association of Persons with Disability, and IFA, Inclusive Friends in Nigeria. We also have coordinating structure like CBN, JONAPWD, and OPDs. For CBN, they are the one that is providing us with technical support, and they also serve as a link between us and other regional country. Then JONAPWD are the lead national implementing partners that coordinate the activities of the OPDs. We also have OPD that also carry out that co-design and take part in assessments, which we did. If you remember, the pre-OCA assessment also identify advocacy priority with us during our co-creation, and also champion the implementation of every activity that will be happening in the state and the local government level, even down to the community level. Next. The project focuses on supporting underrepresented group, which is intellectual, psychosocial, and deafness. Deafness. Okay, so we support them to lead advocacy efforts. Example, OPD organizing campaign to raise awareness about accessible education, and for children, accessible education for children with disability. To also influence government policies by submitting recommendation to government to include disability inclusive education policies in the education framework, and also on health services in national health plans. Then we also have to also strengthen the organization capacity to be able to provide financial management, to be able to, we also provide training on financial management for the organization, project planning, put them throughout how to be able to have enhanced project planning, then also reporting method, how to be able to do a good report that will attract donors. We also work together. We encourage them to work together as a strong disability movement. We have different OPD forming a coalition to jointly advocate for the rights of persons with disability at the regional meeting and conferences. The goal is to ensure that persons with disability actively participate in decision making at the local level, national level, and also regional level. The objective of REA project is to strengthen organization, also to co-create and design of capacity strengthening and advocacy strategy, which we did. If you remember, last year sometime in October, December, that we did a co-creation. So the goal is to support the OPD members to promote and protect disability rights. The objective continue to build the skills of OPDs so they can plan and carry out advocacy activities. And that's why we are all here. Also to support inclusive leadership and decision making within the disability movement, to also improve communication and engagement between OPDs and government officials. That's where we'll be having regular meeting, organizing regular meeting and all of that, so that we'll be able to interface with the ministry and the relevant stakeholders. Our target group, like I said, we have psychosocial clusters, we have intellectual clusters, we also have deafness. These are our focus groups because they are the most identified as the underrepresented group in disability community. Our target is also the local and national stakeholders, which are the government agencies, we have who are the policy makers, like ministry, local government offices, or lawmakers who make decisions about disability policy. We also have persons with disability and their representative organizations. Like we have IFA, JONAPWD, who are the coalition body for persons with disability. So these are our key activities for creation and design of capacity strengthening and advocacy strategy, which we have done and we are still doing. Also support OPDs members and promote and protect disability rights. Key activity continue capacity building for OPD stakeholder forum, which we did last year. Develop advocacy strategy and mentor leaders. You are all here as the leader who we want to mentor, and some of us will be mentored as time passes by. Next. So these are the activities that we have conducted so far. We have project launch here. At the beginning, inception meeting at the beginning, we were putting heads together to know how we are going to start the activity of REA project. We also did OCA with us, and we had PEGA research, which we did concurrently along OCA. We also have stakeholders / PEGA validation, which we did with the ministry, and some of us were in attendance too. Thank you. Do you have questions? Do you have any question? Any addition? We don't? Okay, thank you. So I would like to ask us, should we have one section more before going for our tea break? Okay. Sorry, my colleague has something to say.
Good morning, everyone. You are all welcome to this training. Just as my colleague has introduced, I think we have basic understanding about this project now. I just want to give us a few hints about this training. This training is developed to help us gain basic knowledge on advocacy and disability issues. Each organization is receiving a stipend to implement advocacy action, and want them to be able to carry out high-level, impactful advocacy. So don't treat this training as one of the programs you normally attend. It is a training that has been designed that will take at least 3 sessions. One session is like for 2 days. As you are here today, you are going to come again tomorrow, making it full 1 session. And we have like that 3 times before we exhaust the content. So we have a curriculum for this training. So let us not take it as maybe one of the programs normally come and go. Let us take it as a course we are running. Though we might not be writing exam, but it's something that we should take the learnings very seriously, that at the end, we should be someone that they can call on advocacy programming, and we'll be able to write a proposal that can bring out advocacy actions that can fix a problem in your own cluster, or you know things in disability and inclusion that you can use to engage the government. That is our aim for this project. So at the end of this training, after 3 sessions, we expect that everybody seated here is empowered to be an advocate to the level that you can either develop a proposal, engage the government, or run a project fully. Thank you and welcome.
On that note, I would like to invite Ms. Victoria to take us through the next section.
Hi, good morning, everyone. Good morning. My name again is Oluwapamilerin Victoria. So you can call me Pam or Victoria, whichever one you're comfortable with. Yeah, so thank you, and it's an honor to be here. And thank you to JONAPWD and all the organizations that organize this to bring along and invite us here. So my slides, no, this is not my slide. Yes. Okay. So the name of my organization is Mental Health with DT Foundation. So what we do is design and for mental health inclusion in many programs. So I will just go straight into it because our time is fast spent. According to the agenda, we're supposed to start by 9:30, but it's already, time has gone. But I'll try to make this as engaging as possible. Just give me a minute. Okay, so please, can we go to the next slide? Yeah, so our topic is what? Advocacy, engagements, and policy influencing. And we are introduced, this my own session is just to introduce you to what advocacy means, advocacy engagements, introducing you to it, because you might not really go in depth because advocacy is really broad and large. There are so many aspects of it, but this is to introduce you to the basic concepts, the basic ideas and basic things. Next slide. So by the end of this session, participants, we should be able to define advocacy in simple terms, understand the difference between advocacy, lobbying, and campaigning, and identify basic ways to influence change in our communities. So with my observation in the room and everything that JONAPWD staff have said, we are in different clusters. So we have the deaf cluster, the intellectual cluster, and psychosocial cluster. So I just want us to, in our different clusters, just tell me before we go to the next slide, just a representative from your cluster. You can just mention and say what you understand by advocacy, and what do you believe you've done any form of advocacy before, and what was that thing you advocated about? Just something very quickly, just one person from each cluster that can say something. Okay, yes, thank you, ma. Please, can you say your name? I would like to hear your name. Can we give her a mic? So let me just repeat the questions again. What does advocacy mean to you? And have you done any form of advocacy before? And what was that thing you advocated about? Okay,
Check. All right.
Okay, good morning, everyone. My name is Sam Ijoma Fine Country. I'm representing Intellectual Disability Cluster.
Okay.
So, for me, advocacy is that simple thing, simple push that we have to do every day to bring awareness, bring to notices, bring to the forefront, bring to the public view, to the forefront, bring, raise the conversations about rights, about needs, about welfare of persons with with disabilities.
Okay,
Sorry, I have to mention intellectual because that's my
that's
my constituency. That's for me. That's what simply advocacy means. And then for one, let me choose the most recent one. I've done a lot, but the most recent one I've done just a few months back. We've led a campaign in my organization advocating for safety for young girls and women with intellectual disability, safety against sexual, not discrimination, sexual harassment against young girls and women with intellectual disability. And a project that was termed Empower Her. Yes.
Thank you very much. That was really good. Thank you. Who wants to go for the next cluster? Just one. Yes, please.
So from psychosocial disability cluster.
Please, what's your name?
I'm sorry, Adiola Gumbiadi. Yes.
Okay,
For me, advocacy really means pushing for policies that affect the rights of persons with disability, particularly psychosocial disability. And a recent one for Sharight Woman, where I work, was with the National Commission for Persons with Disability, where we are really pushing for the establishment or the re-establishment of the mental health help desk.
Thank you very much. So the next cluster, please.
Okay. Well, since NNAD, Nigeria National Association of Deaf, we've done many advocacy, like visited NCCE, National Commission for College of Education. We advocated for them to introduce sign language as course of study in College of Education. The same with National Commission for University, NUC, and Universal Basic Education. The point is that we visited all this for advocacy.
Okay, thank you very much. Thank you. These are all fantastic answers. Thank you to everyone for your answers. In fact, I think that we all really understand what advocacy, we've all done advocacy one way or the other. So let us go straight to the next slide. So let us now know what advocacy means. Next slide, please. What is advocacy? Advocacy is what is speaking up to influence decisions that affect people's lives. It involves promoting rights, fairness, and inclusion. So it targets decision makers and institutions. It aims to create positive and lasting change. And a simple definition is advocacy is what? Organized action to bring about change. So I want us to underline the word organized action. Organized action in the sense that it might just be you that is doing the advocacy, meaning that maybe you're using some form of media, social media, you are going to reach people, reaching the key decision makers, people that can really make the change, that can influence that change, that can maybe make that policy to either be repealed or improved upon, or that policy or a new policy needs to be made. So you're reaching out to the key decision makers, it's speaking up and speaking up. So if you are just talking about something to maybe just your friends, these are people that cannot really do anything, it doesn't really make much impact. But advocacy means speaking up on platforms that can reach the key decision makers, that can reach people that can actually make that change, make that difference. Because we are the ones that know where the shoe pinches. We are the ones that know the issues that affect us, that are very pertinent to us. But these key decision makers, those people that can influence these policies, might not understand where the issues that affect us, might not really they might not, whatever is affecting us, it might not affect them. So if we don't advocate and use platforms that can reach these people, it is still not an effective form of advocacy. Am I clear? Is my point clear? So it's organized action. I want us to really underline that word, organized action. Organized action, when I mean organized action, it doesn't mean that we are not setting up organizations, because it can just be you that is doing the advocacy, but you are doing it in a structured way. You are doing it in a way that makes sure that it reaches the decision makers, the policy makers, the people that can influence that decision. That is what it means by that organized action. Are we clear with that? Is there doing a temp check to just see if we are all clear, because there's a lot of moving around and I just want to be sure that we understand. Okay, so from our different expectations, when people were going around the room, people said, oh, they want education for all, work empowerment, inclusive education for persons with intellectual disabilities, increasing knowledge for duty bearers, different things. We all have issues that are very important to us in our different clusters. We have issues that affect us. So it is those issues that affect you that you want to advocate for. So please, let us go to the next slide. So let's look at some key terms. Can somebody, I would like someone to read the first one. The first key term there. Someone from this is the intellectual cluster, right? Yes, can someone from the intellectual cluster read the first key term? Who would like to go? Who is talking? I can't see who. Okay, please, what's your name? Maxwell, thank you. Yeah, please. Yes, thank you very much. So lobbying is a specific form of advocacy that involves direct engagement. So you are directly engaging with what? Government officials or legislators. These are the policy makers, the decision makers, the people that can make a change. So you're directly talking to them. It could be in a room. Maybe there's a town hall meeting going on, and you decide that, okay, you want to talk to the, it could be your local government chairman. It could be in your community, maybe where you live, there's a chief, there's a community leader there that you want to talk to. So yeah, it's a direct engagement. This one is not online. This one is not through social media or through print media. You're talking to them face to face and letting them know these are the issues that are very pertinent or affecting our own community. So maybe an example would be, why are there so many out of school children in my community? And there are so many children that are now being left, and they are now becoming miscreants and entering into bad things. So maybe you are talking, there's a town hall meeting that has been set up, and you're like, I will attend this town hall meeting and I will talk to the community leader, the person in charge, or a legislator, or the House of Representatives or council that is there to represent the decision makers. So it's a specific form of advocacy. And then campaigning, someone from the psychosocial cluster. Okay. Pressure for change. Yes, thank you very much. So, campaigning too is also a form of advocacy. It's public activities that is designed to raise awareness. We are holding placards, like Madam Ijoma said. The campaign for girls. What was the example you gave? The Empower Her example you gave, campaigning for girls that were maybe falling into sexual harassment and things like that. So, public activities. This one is done publicly. So it could be online. It could, people are hearing about, people are seeing about it. The lobbying own, it's not as if you are not be doing it in a closed room. So here, lobbying can be done here. It is public, right? But it is still not like campaigning where people are going out, people are talking about it. A key example I would like to use right now is the protest, because protest can have a bad word, but protest can be peaceful. Like the peaceful protest people have been going about at National Assembly to talk about the electronic transmission of bill for voters' rights. That is a way, that is campaigning. We are trying to campaign and say that this bill must be passed so that the people that they keep saying are marginalized, or the people in the villages where they say they don't have, there's no internet or there's no lights. And that is the reason why the legislators say that the electronic transmission of voters will not be passed. So we are saying, they are insisting and saying that no, this bill must be passed. And so it is public activity. We are all seeing them. People on social media are going and people are snapping pictures. They are staying outside and some people are even sleeping out there in front of the National Assembly and saying that no, this bill must be passed. So campaigning is public activities designed to raise awareness. It could be done. You can go to radio and talk about this. You can go on social media and talk about it. You can put it on newspapers. You can go to outside. You can stand outside and say, no, these people must hear the message. What's the issue that is really affecting us, and people must hear it. So there's a difference. You can see that lobbying is what directs engagement. But campaigning, lobbying can be maybe just you and your friend. After the town hall meeting, you say, okay, you want to go and talk to this, the legislative in charge, the representative that has come, and the rest. But campaigning is, because you know sometimes when people are campaigning outside, the legislators can come and be like, okay, what is people's cry? We have heard you, things like that. It is much more different from lobbying. Lobbying is you are telling them and saying, you are talking to them directly. There's a direct engagement. Campaigning is just, we are telling you on social media, whatever form of, whatever platform, whatever structured platform that we have, and telling them about our issues and building mobilization. I know that when people are now aware, like I said, build and mobilize support and pressure for change. So you do these public activities. Other people can decide to join you. But if you are lobbying, it might just be you or one other person. But campaigning, you gather people, you are gathering, mobilizing people, mobilizing support. People can give you their resources, they can give you their time, give you additional things to help you put pressure and mount pressure on the thing you are advocating for. I hope that explanation is clear. Okay, yes, thank you very much. So the last policy influencing and strategic efforts to share knowledge and evidence to persuade decision makers to adopt or modify specific policies and practices. So why is this different from lobbying? Strategic effort to share knowledge and evidence. When you are doing policy influencing is different in the sense that you are showing this legislators data. Like you can decide to now bring like a screen with slides. You are showing them this percentage of people, this percentage of girls are out of school. These are the percentage of girls with psychosocial disabilities that are exposed to sexual harassment. You are showing them the evidence. You are showing them the repercussions. You are showing them the consequences. You've already gone to do your research on what, if this issue is not addressed, on what can happen if it's not addressed immediately. So it is much more different than lobbying, because lobbying, you can just come and just say, this is where the issue pinches, and we believe that if this issue is addressed, this is what's going to happen. But in policy influencing, it's strategic effort. You must have already gone to do your own background research. You will have already gone to gather knowledge, already gone to do the technical work you need to do to present evidence. There has to be evidence. And you know that when you're talking to legislators, they don't have time. So you are not there dragging your words or speaking a lot of grammar and the rest. You are just telling them this and this. If so number of children are out of school, if they are exposed to sexual harassment, if this is like, you are telling them point blank and telling them straight up what is really happening, and really telling them, okay, if you are able to address this issue that we are advocating for, this is the impact it's going to make in society. This is the change it's going to bring in the society. So this policy influencing is much more intentional. It's much more strategic. Like you are much more technical when you want to do policy influencing. So whenever you see people that have maybe closed door meetings with House of Representatives, or closed door meetings with people in the Senate and things like that, and maybe they are doing like a form of policy influence, they've done their background research. They're not just talking based off their head. They are talking based on facts and figures about issues that are happening in the society. Is my explanation clear? Okay, I see that some of us are looking like we are sleepy. I hope my presentation is going well. I hope what I'm explaining is going well. Okay, yes. So can we go to the next slide? My own way of lobbying. Yeah. Okay, so we want to talk about the difference between advocacy and service delivery. Advocacy and service delivery. So I'll just read here and say, service delivery is what? Providing direct support, e.g. food, training, healthcare. It helps service delivery helps individuals directly, and it solves immediate problems. An example is giving assistive devices. So when you are doing service delivery is like, okay, we've seen that so number of children need maybe hearing aid, and you give them hearing aid. Or these people, we've seen that, the people in our community, they always go hungry. There are so many children, and give them food stuff or something. It's like it's just addressing a direct support, just an immediate need that is just given. Okay, we've seen that so many young youths are unemployed, and then you just give them a form of training. Let us train them on what are those trainings that many people like to do. And yes, entrepreneurial skills like sewing, maybe making of soap, something just meet their direct need. So that service delivery solves immediate problems, but the thing is that it is temporary. It's not permanent. It doesn't bring about what systemic change. If we go to what advocacy means, advocacy is what? It's organized action to bring about change. It aims to create positive and lasting change. What are we saying? Positive and lasting, something that is lasting. So if you're doing service delivery, the hearing aid might get bad, it might spoil, the food will definitely finish, the food stuff will finish one day. The training, if after a while if there's no like a follow-up for sustainability of those training, people will forget and move on with their lives and continue to go back to the issue will still remain. But what does advocacy do? Advocacy what? Addresses the root cause. Advocacy addresses systemic issues behind those needs. Why are there so many out of school children? Why are teachers being owed salaries for months on end? Teachers in public schools and the schools. Why are the buildings dilapidated? Why is it that it's hard, many public buildings in FCT, it's hard for persons with physical disabilities to enter into these buildings easily? Maybe the lifts are bad. And why those issues? So these are issues that you want to address to make sure that the policies, whatever policies that will make sure that children are in school at the time they are supposed to be in school. There's food security. Farmers are not being attacked in their farms, and we are now saying that there's no food, there's no food stuff is expensive, people cannot eat. So you're addressing the root cause, because all of these things are just issues. They have causes. There's a reason why there's food insecurity. There's a reason why there's insecurity in the land. There's a reason why there are so many out of school children. So what does advocacy do? Advocacy is trying to address that root cause so that there's lasting change. If you just decide to give those children food, the out of school children decide to give them food, they will still be on the streets. If maybe you say, okay, and the teachers, they are not, they've not been paid salaries, what's like an immediate thing that you can just do to teachers to just maybe just give them money for that period? It still has not addressed the reason why teachers have been owed salary. So you are meeting the decision makers, the policy influencers, and asking, why are this, how come the money that has been allocated for education in FCT, why has it not been used? Why have teachers not been paid their salaries? Why are the school buildings, why are they being dilapidated? So the issues that affect us, like affect us personally, you are looking for the root cause and wanting to reach out to policymakers that can address those root causes and cause a lasting change. Advocacy creates large-scale sustainable change by altering policy or implementation. And you know that Nigeria is very good with policy. We have very good policies. In fact, many countries, I have heard, have even come and even adopt our policies and use them in their own country. The problem we have is what? Implementation. So we have really good policies, but these policies are not implemented. And so if our issues are the issues that affect us, and we are saying that these issues, like I said, create large-scale sustainable change by altering policy. So there could be an existing policy, but that policy is not what? That policy is not good enough, or it is not in-depth enough to address that issue. Or the issue or the policy is there and it's in-depth enough, but it has not been implemented. So you want it to either be altered, to be improved upon, or to be implemented. And advocacy seeks long-term solutions through system change. An example is advocating for government funding for assistive devices. So with my explanation, who can maybe give me an example of what service delivery is and an example of what advocacy will be with what I have explained, so that I know that we all understand what I've been saying here. I'd like to hear from anyone that would like to speak up. Just an example of what the difference between service delivery and advocacy. Like something. Okay, okay, thank you very much. Please say your name first. After, then you can speak, sir.
Okay. Service delivery.
Please, what's your name?
My name is Peter Ojowi.
Okay, Peter, thank you.
I'm from FASIP. Now, service delivery, it provides immediate support. Like when somebody is in need of food, hungry, you provide food immediately for the person. Yeah. While advocacy, instead of providing food for the person, you create a way or empower the person on how to farm or create food, a long-lasting food, a way that the person can get enough food instead of begging. You have your own access to food direct.
Yes, thank you very much. Who else wants to say something? Sir, please, can you?
Looking at this, advocacy gives birth to service delivery.
Yes, yes.
Because it is advocacy that gets the idea of what service you want to deliver.
Yes, thank you very much. I didn't even think of it that way. So that's an angle. Thank you very much, sir. Sir, please, what's your name?
Adejumo.
Okay, Mr. Adejumo. Thank you.
Adejumo.
Okay, Adejumo. Thank you very much, sir. Yes, so advocacy gives birth to service delivery. So there's something Peter said about like training the person and the rest. So you know, when you're doing advocacy is not just for one person. You are trying to advocate for a group of people. So when you are trying to advocate, it's not just, you might be advocating for selfish reasons. When you have a person, you have a sister, you have a child that is from a marginalized group or a vulnerable group, But the thing is that when you're advocating, you know that it doesn't just affect, if that policy is being implemented or being developed, it's not just that close person that it affects a group of people. So advocacy, what does, it impacts a large group of people. Service delivery might just maybe, yes, a certain group of people, but advocacy is much more large scale and affects a larger group of people, right? So because we are dealing with policies here, and policies, when implemented, really bring lasting change to the lives of citizens. So next slide. Thank you. Okay, so now we go to advocacy versus lobbying. Advocacy versus lobbying. We did advocacy versus service delivery, and now we are saying advocacy versus lobbying. So in the first point that I said relationship, all lobbying is advocacy, but not all advocacy is lobbying. All lobbying is advocacy, but not all advocacy is lobbying. Please, who would like to expatiate or explain what that sentence means? All lobbying, yes, ma'am. Please, what's your name first?
No, let me clarify.
Okay, the question
first.
is, can you...
The question says all lobbying is advocacy, but some advocacies are not lobbying, right?
Yeah, yes.
Is that the question?
Yes, so I'm saying yes.
Yes. Yes, my answer is
What's her
yes.
name? What's your name?
All right, my name is Martha.
Martha.
NNAD HR.
I didn't get that, sorry.
NNAD, from NNAD is Human Resource Manager from NNAD. So there are some advocacies that are research based. And so this, you don't lobby on that area or PT. This is a research based advocacy. You have to investigate and find out, and there are possible risks there. So you have to implement this. You are not begging them. But for lobbying, it's as if you are begging somebody to please encourage people to persuade people to do. So not all advocacies are lobbying, but all lobbying is advocacy.
Yes, thank you very much. That's a fantastic explanation. Thank you. And please, who else? Yes, ma'am, please. Me.
My name is Bolanle Ogwenson. The way I look at the two subheading, advocacy and service delivery.
Okay,
from my own point of view, I will say service delivery is more of the services provided to them by the immediate family to our people, by immediate family. Then the advocacy is by we going out or join any organization to carry out the problem we are facing. Let them know what's the causes and the problem we are facing. We are advocating for them. But by doing service delivery, we are the one, the immediate family are the one mostly doing that service delivery, not the government, not other people. Because before you take your child out, so that please, I need help, you should have been the one to do most or seek or source for their immediate needs and provide for them.